Okay, so I chose epilepsy for my disease because I just find it interesting. And for the theme, I went with purple because that's like epilepsy awareness. And also I kind of did like lightning because epilepsy is often described as an electrical storm like going off in your brain. So epilepsy is a neurological disorder in which brain activity becomes abnormal. And yeah, it's described as an electrical storm. And 3.4 million people in the US have epilepsy. And yeah. Cell-to-cell communication is the transfer of information from one cell to another. And how epilepsy is a breakdown of cell-to-cell communication is the brain cells are interrupted, which causes information to not be correctly transferred, causing seizures. During normal brain development, the normal brain transitions into a hyperexcitable brain. And this process is called epileptogenesis. There are numerous factors which cause this. For example, increases in excitatory or decreases in inhibitory synaptic neurotransmission, alterations in voltage-gated channels or intra-extracellular ion concentrations, or a temporal summation in the postsynaptic neurons. So this is normal neural activity. It's like just pace and it's, just goes through. And this is abnormal. It's more like quick and all over the place. So what causes epilepsy? Epilepsy is not always caused by a gene. It is possible that the genes that cause it are the EFHC1 gene, located on chromosome 6p12p11, and the GABRA1 gene located on chromosome 11. And 65 million people worldwide are living with epilepsy. Who is affected by epilepsy? Epilepsy and seizures can develop in any person at any age. However, it is more common to be diagnosed in younger and older people. And the symptoms of epilepsy are temporary confusion, staring spells, stiff muscles, uncontrollable jerking of appendages, loss of consciousness or awareness, and psychological symptoms like fear, anxiety, deja vu. And the staring spells and like the deja vu and all that usually happens like before they experience it. And that's like signs that they're about to have a seizure. So this is like a graphic of the age that children are identified with epilepsy, and it's mostly around when they're like 5 to 6. So yeah. Treatments include anti-epileptic drugs, and there's surgeries. There's like multiple surgeries. You can get part of your brain removed. There's a procedure to put like a small electrical device inside your body that helps control seizures, and you can actually sometimes treat epilepsy with a ketogenic diet, which is a very low carb, high fat diet, and that helps sometimes. And the outcome of the person affected, it can cause sleepiness, confusion, limited movement. Sometimes it causes you to be unable to move, difficulty talking or breathing, and brain damage. And people with epilepsy are 8 to 10 more likely to experience other chronic conditions such as dementia, migraine, heart disease, and even depression. And this is how you help someone with epilepsy. A lot of people think you should put like something in their mouth, but you should never, don't try that. Just like put something, turn them on their side, and try to cushion their head, like you can use a backpack, a jacket, whatever. Loose and tight clothing. Don't put anything in the mouth. Look for their ID, and of course call 911. And I'm gonna try to see if this will.
You can just click on that YouTube link.
Laser ablation, also referred therapy or
So this is like one of the surgeries that they can do. It's the thermal ablation surgery procedure.
You may have to.
about the width of a pencil to allow access for the laser device, which is called a laser probe. The procedure is performed in an MRI machine. While you are in the MRI, the doctor will guide the laser probe through the opening. Because the procedure is MRI guided, the surgeon can see the specific area of the brain to be ablated. The surgeon controls the delivery of laser light energy to the targeted tissue. This laser light heats and destroys the affected tissue. The precise nature of the procedure helps to lessen the likelihood of harm to nearby healthy brain tissue. When you wake up after the procedure, you will have a stitch or two in the skin where the probe was inserted. In general, patients experience a short recovery time with minimally invasive procedures. You will schedule follow-up appointments with your doctor as instructed. Each person's situation is unique. Your doctors are the best qualified to let you know how a procedure may affect your outlook.
And then this is a normal electroencephalogram, which is like a brain scan. As you can see, it's like kind of controlled. And this is one with someone that experiences seizures. It's all over the place. And this is the genes. This is the GABRA1 gene located on chromosome 11, and this is the EFHC1 gene. And it mostly affects the temporal lobe. That's where epilepsy is like most